This is Deepal Dalal from the Desert Foot Conference in Phoenix, Arizona. I have Dr. Wendy Cole with me today, who gave an excellent lecture on skin substitutes. Thank you so much for the lecture today. It brought up some really interesting questions which I'd like to ask you. So my first question is, how do you decide which skin substitute to use, and how do you decide what the appropriate patient is to use it on?
So first you have to make certain that you're doing a full history and physical on the patient from the get-go. So you have to know their past medical history, their comorbidities, their medications. As our patient population ages, they become more complex. We have to make certain that for diabetic foot ulcers, we're properly offloading. For venous leg ulcers, we're controlling edema. And once we've done our due diligence and we can actively and correctly treat the ulcerations, then I can choose which skin substitute would be most appropriate for that patient.
Excellent. So if you see a chronic non-healing wound, let's say greater than 6 months, that has been coming to your office, would there be one that you would recommend using first over the others, or does it depend on what the wound looks like or the quality of the wound itself?
So typically in wound care, if we're using advanced modalities and advanced dressings and we're treating the patients for 4 weeks consecutively, and again, we've made certain that the wounds aren't infected and they have adequate blood flow and we're doing proper offloading or compression therapy, and the wounds aren't progressing by 40 to 50% in that 4-week period of time, then it's time to really look for those advanced modalities such as skin substitutes. Oftentimes I'll start with PurePly, which is an antimicrobial substitute that helps to optimize the wound environment. It gets rid of biofilm. It also gets rid of proteases, and I'll use that initially to treat all of the bad actors that we find in these chronic wounds. Oftentimes patients will go on to heal with just the use of PurePly, but in certain instances when the wound has stalled and not progressed to healing, I typically will move to either a cellularly active product such as Apligraf or Dermagraph, or most commonly I go with NewShield, which is the dehydrated amniotic tissue product. I've done a lot of research and I have a lot of experience with amniotic tissue products, so they're kind of my go-to, and really I've seen them to be most effective in these chronic recalcitrant wounds.
So in your lecture, you also mentioned amniotic membranes and your interest in that. Can you tell us a little bit more about how your interest sparked in that field?
So I've done a lot of research and I've acquired a lot of cases throughout the years utilizing amniotic tissue. In 2014, amniotic tissue grafts kind of entered into the wound care market full force. In 2014, we also saw Medicare bundle the reimbursement codes for cellular tissue products. So some of these products that were out there previous to that became not cost effective. And so amniotic tissue came into the market and they were cost effective, and I've seen great results with that patient population. So I started doing a lot of research and different cases utilizing amniotic tissue. More recently, a small biotech startup company called NewTek entered into the market, and their grafts were amazing, and I was getting great results from those as well. Organogenesis, about 2.5 years, acquired that company, and they're making those grafts commercially available. So I continue to do research and work with amniotic tissue to see exactly what patient population is best serviced with those grafts, and I'm getting really good results.
That's excellent. In terms of prepping the wound for any of these products, is it required that they have to go to the operating room, or can it just be a sterile prep in the clinic, or does it not have to be sterile at all?
So cellular tissue products that are commercially available in the market are terminally sterilized, so they can be applied in the operating room. Most commonly, though, we are applying them in the outpatient wound center or the physician office. So the wound bed should be prepped as we would normally to remove all devitalized tissue that's present with a good thorough debridement, but if the patient can tolerate that in the wound care center, that's the optimal place where these grafts should be placed. There's really no need to take a patient to the OR to apply these grafts.
That's really helpful in a patient care standpoint. You don't have to take them for multiple visits. Excellent. And then I guess my last question for you is: have you seen any complications come up with these skin care substitutes that you may not have otherwise seen?
So cellular tissue products are probably some of the most vetted products out there on the market. We've been studying them for over 20 years, so there's a lot of rigorous data and research that goes into these products before they enter into the market. So they're very safe, and I have seen absolutely no problems in my patients utilizing these skin grafts. So you could feel safe that you're applying a product that has a lot of research and a lot of testing behind it.
Thank you so much, Dr. Cole. That was excellent insight on skin substitutes, and I really appreciate your time. This is Deepo Dalal again from the Desert Foot Conference. Please stay tuned for more segments to come.